Okay.
He wants to feel that love.
Yeah, 724. Let's get Dr. Hoa, one of the
Members of the Physicians Advisory Group. Hi,
Right.
Dr. Hoa.
Hi, Sabrina. Hi, Chris. Good
Thanks
morning.
for talking with us.
Yeah, and just first of all, because we're just going to start with here. Dr. Felix Cabrera has been a regular on the show and reached out to get him to call in. And he advised me that we now had to go through Adeloop to get any interviews with him. And so I put the ask out to Crystal Paco St. Augustine yesterday. I never got a response on it. So that's where we are. But tell me, is that concerning for you at all that we're muzzling doctors?
I'm not sure what the scenario is, guys. I mean, I think that we are free to say anything on the radio that's responsible and try to help the patient and the public understand more about the COVID-19. So I'm not quite sure about that reply.
Yeah. How about the reply I got from Adeloop, which was no reply? I think that was a reply. And I totally agree with you. Dr. Cabrera has really put out a lot of great information.
Yeah.
He's been a voice, a steady voice of, impressing upon people how serious we should be taking this COVID-19 crisis. And I just felt, I put something on my Twitter that really, of all the things to worry about, you want to put a gag order on doctors? How does that save lives? You guys focus on saving lives and not, I don't know what the motivation was before that. And it's interesting because, we can get other directors who are, a vital part of this COVID-19 response. And I don't get it. But anyway, turning the page now. Thank you for coming on. What kind of update do you got with us, Doc? What can you tell us about these? Over the last few days, we've had a couple of zero positives from public health testing.
Yeah, it's a lot. We're going to do a lot more testing. Public health trying to triage who's a high priority, and it's not high priority, then they go to DOS. So we test a lot more, and DOS is response time a little bit slower than public health. It takes anywhere from 4 to 7 days. So any test run the last 2 days, go to Hawaii, and sometimes you don't find out 4 to 7 days later. So and so far, depend on what public health triage a patient. You can have zero here, but I just want public health. I just want the public to understand that those numbers really don't mean much. Really, don't put your guard down because we all keep our finger crossed. That's a true representation, but it's really hard to tell with this virus. So we still have to be cautious and do not put our guard down. If we are beating the virus, then we got to continue to do what we do. I'm really happy to see the roadblock. I know a lot of people don't like it, but what I tell you, this would be a long time ago, is to keep people at home. I waited in line, from about 20 minutes yesterday, but that's just like you go to the airport through TSA. It keep you safe, and that's what the roadblock's all about.
Yeah, I was on my way home from work, and I was in the roadblock traffic, but I was hoping that I would get to talk with the National Guard to hear what he was going to say to me, but then they broke down, and I was like, man.
Oh no, they actually
Sabrina needs that interaction.
Yeah, they give you some information about COVID-19. They ask you certain questions.
Mm-hmm.
It's educational for them. It's very brief. At least they say something, and they
Yeah.
ask you where you're going.
Mm-hmm.
So I don't know. It's inconvenient, but this is where it protects the public. There's a few of us
Right.
that still is not follow the rule, and those are the ones that will first come to the emergency room and first come to the clinic and say I'm sick. And unfortunately that's how things are.
Yeah,
Right.
and it's now from 10 to 4, I believe, and then 6 to 10, and they now have a lane for essential workers and emergency personnel, because I think that wasn't the case on Saturday when it first went into effect.
Yeah, I used that lane yesterday and it worked. So I mean, you can really lie to your I think most people know who's essential. So
Right.
It did help a lot.
Doc, I kind of appreciate that they did these checkpoints, threw them out there, saw what the problems were, and kind of went back to the drawing board. We spoke with the TAG yesterday, TAG Esther Aggie, and she said, yeah, we're fine-tuning trying to add an extra lane. So I think they're doing what they can. But I want to go back to what you said about TSA and protecting the public. And I think a lot of people out here know that that's why we're doing these checkpoints, is because they're just trying to add that extra measure. And has it worked? Are people staying home more? I believe so.
I agree with you. I see less car on the road, and people are staying home. It's not a hassle to stay in line when you have no perks out there.
Yeah.
I wanted to go back to testing, and we've seen like you mentioned, and like Chris has mentioned about the zero positives from public health. What I want to know is about the DLS, the commercial testing, when those results really start coming back, because like you said, it's 4 to 7 days. Do you anticipate seeing some higher numbers of positives just from the DLS category?
Yeah, I think so. And so far, they are report positive coming back from them. The interesting part is that I talked to some physician is that this past weekend will be a test for us. We'll either see the rate go up or go down because the holiday, the mass Easter, and it will reflect until about a week to 10 days from now. So if people are going to get sick, it'll be a week to 10 days from now, they will come in. So next week you'll find out if we truly control this thing or not. If there's not a surge of people coming in, but from the there's still people going to be sick out there. So like I say, don't put your guard down.
Right, yeah.
Masks everywhere, and wash your hand and minimize the going out to the public if you can.
Yeah. Doc, can I just ask you, are physicians still sticking with Dr. Cabrera's analysis and the state surgeon, Dr. Michael Cruz's hospital expansion efforts? Do you know if that's something that's still moving forward as we speak?
Well, Chris and Sabrina, we still have to moving forward with that. In medicine, we look for the worst and hope for the better, right? I mean, never hurt to prepare. Never hurt to over-prepare, and if it doesn't happen, then Dr. Cabrera and Dr. Mike Cruz will be glad to be wrong. This is something that, as a physician, we are much happy to be wrong. So, like I say, it's a projection, the best I can do. But like I say, it doesn't happen. It doesn't happen. But like I say, that's the worst scenario, and we have to look for the worst scenario. A lot of people criticize the curve and it's overblown, but like I say, if you don't protect the public and don't prepare, then when the thing comes, it's going to be bad. So it's okay to prepare.
I think it's bad. I mean, we have over 500 positive cases on the Roosevelt. We're nearing 140 cases outside the fence line. We've had 5 deaths. I think it's pretty bad.
That's the case of the TR is that they tell you one thing. If when you're a group of people together in closed space, yes, you will have all this outbreak. So that's why it's very important to isolate and stay home.
Good point,
if you
Doc.
stay home, then you don't have the outbreak like the TR. But they don't have a choice. They're in a little tight quarter in the ship. That's why everyone needs to stay home and not barbecue with the next door neighbor.
Doc, I want to go back to this latest, the 5th fatality. Our condolences again, but there was something in the JIC release that I saw where this woman who had comorbidities was admitted to the hospital. Was it the day before she passed, Doc?
Yeah, she passed really quick. When she hit the front door, and she passed the next day. And again, the elderly have a very high mortality rate, and complication. That's why, before the Easter break, I say, stay away from your elderly loved one. Don't hug them. 10 feet away from them. But at this point, we just have to give our love a bit differently to the elderly.
Right.
Just we love them, we stay away from them so they won't get sick.
But Doc, just outside looking in, because obviously I'm not a doctor, but what do you make of this patient who checked in the day before? I mean, she was already very, very sick.
Well, she's sick already, and this, it's unpredictable. This thing can basically destroy your lung in a matter of minutes. You can be stable, and then you just crash. And then you can be in the best hospital in California. It's going to happen. You're going to pass away. So She probably have a very bad infection, and either she waited a bit too long at home. But it's a lot of factor that that caused her to pass away so quick within 24 hours
Right.
in the hospital.
And that's why I wanted to ask you, do you have anything to say to these people who were, telling them to stay home isolate? At what point do they need to reach out to their doctor or their clinic, before it's too late?
Yeah, I always tell patients, if you're coughing and you have a hard time talking to your relative, you can't finish a sentence. It's time to go in. That's the key. Is that you can talk to me in a full sentence, okay, but if you start and take say a few words, take a deep breath, or you can't breathe, it's not time to stay home. It's time to head to the emergency room.
Well, thanks for that, Doc.
Yeah, so that's the key.
I wanted to ask you, going back to the testing, we just saw on the CNMI governor's Facebook page that they got 20,000 test kits from South Korea. Did you see that?
Yeah, we have to be careful. I'm not sure what the situation CCMI is, but for us, in order for us to get in the test kit that federally funded, it had to be FDA approved. You cannot use in a test kit that's non-FDA approved. The first test kit to come in by one of the wholesalers was on the application, but it's not approved yet, so we turned that down. But the problem with those test kits that's not FDA approved is that they have some false negative, false positive that is really pretty high. So
Wow.
You can test them, but it's unreliable, and you cannot go with this data. Again, this is a blood test, a test for your antibody, and it's not a confirmation test like PCR does. So you have to be careful how you use those things.
But
Wow.
are you aware what kind of test kits they received? Considering that I thought they don't have the capability to run tests there. They go through Guam.
Well, some of those test kits, I think they receive as a quick test. not
Okay,
the
so
regular
those would be
test.
the rapid.
Well, Doc, I think the obvious
yeah.
question is, how do they get it before us? And why didn't we get 10,000?
Of course, we can have it delivered here, but the problem we can't use them.
I see.
Just like I say, it's not FDA approved.
Yeah, I got you.
And and you don't want the company to use them and send people back to work when they have a false negative, and then you infect everybody. So you have to be very carefully use those test kits and be monitored by public health, and not just anyone can buy them over the internet, which we can, but it's not
Not
advisable.
responsible, yeah.
Yeah, I mean, there's a new Abbott PCR test that take 10-15 minutes. I know that FEMA sent one out to Guam. I'm not sure when it's arriving. It's only 8,000, 19,000 of those machines make. So they are some, kind of scarred to obtain. But I know that FEMA sent one out to Guam. It's not sure when it's going to arrive here, and that would change the game. And DOS is stepping up. They're going to do the test here locally, so you don't have to be sent to Hawaii anymore. GRMC has sent up their test. So once those things are standing up, we can do a whole lot more tests in the very, very near future. So just hold tight.
What about the ventilators? Have you been made aware? Because I saw in one of the FEMA updates that they were shipped out on April 11th, I believe. Have you heard whether or not they've arrived, the 30 ventilators that we were anticipating from FEMA?
Yeah, I'm not sure they arrived or not, but we have still went with very little people in ICU on the vent, I believe. But it's not the number of vents that we have, guys. It's the nursing staff that run them. You can have all the vents in the world sit in front of you, but you only have a few nursing staff run them, and that's a different thing,
Right. No, I get what you're saying.
Yeah. So
because you have the 50-bed FEMA equipment that's coming in for their FMS, their field medical hospital or whatever it is, and I think the governor's plan was to have at least 2,000 excuse me bed capacity.
Yes. So those are the plan. Hopefully, we don't have to use them.
Right. But you said we have to be prepared.
Yeah.
And I mean, we could have all the supplies, like you said, in the world, but if we don't have the people, I mean, what do we do?
Well, I think we still got to get the supplies.
Well, yeah. And is there any effort on that, trying to get these nurses and more
We
healthcare
are,
workers?
Yeah, we entertain the idea of getting nursing staff even from Taiwan and from other countries come in to help if they can, in case we need them, and that's just on the table. So everywhere you can pull, you're gonna pull. So we give nursing staff that is not qualified before the emergency license to do different stuff. So yeah, they're trying to do everything they can. Like I say, everything's on the planning stage for the worst. Hopefully, they don't have to use them.
Yeah.
Okay.
All right, Doc. Well, thank you so much for your time. I know you got a conference call coming up this morning, so I appreciate the little bit you gave us.
Wait, when's the next press conference where all the doctors go to Adeloop and give their latest trajectory? When's the latest update?
Yeah, we have an advisory meeting tonight, and we discussed that. The biggest thing we discuss right now is what to do with our people here in Guam that will soon get laid off and lost their health insurance.
Yeah.
That's something that we have to put our head together tonight and try to figure out, because I tell you, they will run out of medication, and there's a non-COVID complication coming in, because this is going to take several months to a year or so for all those people to get up from where they are.
Yeah, thanks, Doc. I know last time we chatted, I wrote that up. It's a good story. I'm glad you guys are keeping an eye on that.
Yeah, so we will have to talk about it tonight now, and that's one of the new subjects we're going to talk about.
Okay, so then we'll get you on the phone tomorrow for a little catch-up.
Okay.
Thanks, Doc.
Thank you, Doc.
You're welcome.
Okay.
Bye-bye.
There you go from the American Medical Center. That's Dr. Hoa Nguyen, 740.
Like I said, in the past, he led us with the Guam Medical Association efforts in the Philippines after the super typhoon that hit there a couple years ago.